Hey folks, Ryan Smith at Better Life Carolinas. I'm going to take a few moments to talk about one of our newest offerings at the clinic. If you've been a patient here in the last year to year and a half, you may have seen some of the construction in the backside of the clinic for our new hyperbaric oxygen therapy chamber. It's been quite a project, and I think if you know Todd, he could probably attest to the amount of things that he's learned about pressure manifolds and oxygen tanks and who knows what else. But we can finally say that our chamber is up and running. And I thought we might talk a little bit about why we're so invested in hyperbaric oxygen therapy. We call it HBOT for short. HBOT has been around for a long time. Frankly, that science behind HBOT came out of dive medicine. It's really the only way to treat people who are suffering from decompression sickness or the bends. So that's been around for a long time, and over the past several decades, a lot of hospitals and clinics have begun to use HBOT as a means of healing chronic wounds. But there are a lot of other indications outside of the bends and wound healing, and as an age management clinic, we're interested in many of those. So I thought we might talk about that today. So the way HBOT works is through pressure and oxygen. It's kind of like a soda can effect. Think about a soda can before you pop it. Those contents are under pressure, and all the carbon dioxide that bubbles out once you pop that top, that carbon dioxide is actually dissolved within the liquid, and pressure is what causes that to happen. Pressure will increase the solubility of gas into a liquid. And the same principle applies when we put someone into the hyperbaric oxygen chamber. We increase the pressure, we also increase the surrounding oxygen, and that drives a much greater quantity of oxygen into the bloodstream. Normally, our red blood cells are what take up oxygen from the air that we breathe and deliver that to our tissues. But in the hyperbaric chamber, more oxygen is actually dissolved in the liquid of our blood than is found attached to red blood cells. So it's a very different way of delivering oxygen. And all this means is that every cell in your body gets exposed to much more oxygen than it otherwise normally would. That is fine in and of itself. You might feel an increase in mental clarity or focus. You might feel energized after a session. But really, the benefit to hyperbaric oxygen therapy comes after the session is over. When we take you out of the chamber, your oxygen levels drop from what had been quite a high level back to normal. But your tissues, your cells, sense that drop, and they measure oxygen, but not in absolute terms. They measure it in relative terms. So if your cells see a drop in oxygen, even if it's from very high back to normal, that triggers a lot of cellular defense mechanisms geared towards low oxygen, hypoxia. So these low oxygen defense mechanisms are very profound, and it's kind of like exercise. This level of stress that we are creating in your body with hyperbaric oxygen promotes a lot of lasting, longer term beneficial changes at a cellular level that can be good from a longevity standpoint. One of the things that we know happens at a cellular level is that cells begin to release a signaling molecule called HIF-1 alpha, and this molecule serves as a transcription factor for DNA. It causes lots of different genes to be turned on, and that results in a multitude of downstream effects that help cells to clean house. You may have heard of sirtuins. These are some of the longevity molecules that are found in cells. They become activated by this process. You may have heard of telomeres, the caps on the ends of chromosomes. One of the theories behind aging is that telomeres gradually shrink in size as we age. But there's good evidence that HBOT and this cellular defense process can reverse that process and actually expand telomeres. There is good evidence that hyperbaric oxygen can reduce inflammation, or at the very least change the way your body mounts an immune response. And that immune modulation can be very effective for chronic inflammatory states. So as all these cellular changes that we've talked about occur, your body begins to see adaptations that can really be beneficial. Over time, after multiple sessions, your body begins to develop new blood vessels. That's a process that we call neovascularization. And you can think of situations where that might be helpful. Patients who've had a stroke, heart attack, any kind of problem with circulation, traumatic brain injury. All of these are situations where new blood vessel growth might be beneficial. In addition to new blood vessels, new neuronal connections can also be spurred by this process, and that can be quite helpful as well. HBOT has been shown to increase soft tissue healing. That's part of the reason why it's used so frequently in wound care clinics, but it can apply in lots of other chronic disease states as well. Collagen formation is increased with HBOT, so that can be of particular interest in those of us who are looking to do something about wrinkles and changes to our skin as we age. We talk a lot about the concept of hormesis in age management medicine. Hormesis is this idea, this concept that stress at a certain level can actually promote beneficial lasting effects. And if you think about it, exercise is a form of hormesis. Again, this is kind of what hyperbaric oxygen is doing. But just like with exercise, one session probably doesn't do a whole lot for you. It really requires multiple sessions, multiple experiences at that high level of oxygen, and then reverting back to that normal level of oxygen to spur these lasting changes. So depending on what your potential issues might be, depending on what you're looking to get out of hyperbaric oxygen, we can help craft a plan, a regimen for a certain number of treatments to optimize the likelihood that you achieve the outcome that you want. So if you're interested in hyperbaric oxygen, feel free to give us a call. We'd love to talk more and really apply this particularly to whatever your concerns may be. Thanks for your time.